We've gone past on my screen. So, my name is Helen. I'm from Tracks, and today I have with me from the Heart Foundation, Shelley McRae. She's the Heart Health Lead there in WA. So I'd like to start today by acknowledging the traditional owners of the land from which Shelley and I will present, the Whadjuk people of the proud Noongar Nation, and pay my respects to elders past, present and emerging. Pay my respects to the Aboriginal people's resilience and courage, and acknowledging the grief and loss they've gone through in the past and how that must be impacting them now with the new virus around us all. So, welcome to everyone. Today is around evidence-based resources for cardiac rehab. I don't know about anyone else, but we seem to be flooded with information. And we just wanted to pull something together to ensure you had what's the latest and what's, good evidence-based. So I'm going to pass you over to Shelley now, and Shelley and I'll be pressing through the slides, so you'll excuse us if there's a little bit of coordination happening. Thanks, Shelley.
Helen, do you want to go? Can I wait till you get the slides up, Helen? Or can people see them? I can't see them from here, but you're on mute, Helen.
Shelley, can you not see the slides?
No, I can't, but if you tell me they're there, that's fine.
That's fine. So we're on slide 1 now, around staying informed.
Okay, can everyone else see the slides? Do we need some confirmation from the site? Yeah, I see Sandy nodding. Okay, cool.
Yeah, we can see them.
Thank you. Okay, great. And can you hear me okay? Good. Thanks for nodding, Sandy. You're a legend. Okay, so in response to the COVID-19 pandemic, the Heart Foundation has launched a campaign last week, led by our key spokesman and Chief Medical Advisor, who's also a cardiologist, Gary Jennings. And our evidence team quickly pulled together the latest evidence that we have to date on COVID-19, but particularly we wanted to inform the general public about COVID-19 and some of the concerns they were having. Excuse me, phone ringing, forgot to put that on silent. Certainly some of the concerns they were having because people with heart disease fall into a high-risk group. So there were about 5 key messages part of this campaign. It's been launched online, through socials. It hit the TVs on the weekend, so you might have seen it, Channel 7 and Foxtel. And we will continue to see it for approximately another month. And during that time, we've extended our hours for our helpline to answer any questions and queries and concerns and hopefully allay some worries for people with heart disease. So the first message for people, which is on slide 3, Helen. Got it? Yep. Is to keep looking after your heart and stay connected with your doctor. It's really important that patients maintain their current treatment and medication plan and to continue taking medicines as prescribed. including those medicines used to manage blood pressure. On the medicines front, I'm sure you have probably heard some of the news about the connection between ACE inhibitors and ARBs and COVID-19. However, and it is because of the same receptor involved with the infection, and the theory is that it might make the condition worse or the infection worse. However, there's not enough evidence for us to tell people at this stage to stop taking their medicines. So this is the message that we're trying to get across. So it's really important that people stay connected with their doctor, and that there are new arrangements that people can get in touch with their doctor remotely. But I'm speaking largely to a regional audience, so you would be well aware of that. In fact, you're probably doing it well before, not. It's probably part of your usual practice for many of you anyway, even prior to COVID-19. So that's one of the key messages. The second key message is to not ignore a medical emergency. Now, we are hearing from overseas and anecdotally locally that people are avoiding going to hospital for emergency events, such as a heart attack, so presenting with chest pain, because they don't want to go to a hospital when they're in the middle of a pandemic and be perhaps exposed. But we need to reassure people that, yes, our health system is busy dealing with COVID-19. However, their heart matters and medical emergencies still require urgent care. It's important that people get urgent medical assistance if their symptoms become severe or they become worse quickly. So if someone is experiencing the symptoms of a heart attack, for example, they need to call 000 immediately. Joondalup Hospital, for example, Jenny Deeg, cardiologist Dr. Jenny Deeg was telling us the other day they have separate entrance for their COVID-19 patients and for their other emergencies. So there is separation where it's possible. So we need to encourage people to not delay seeking treatment. And just a reminder on slide 5, I've put in the link to the warning signs action plan. Should people need reminding about the warning signs of heart attack and what to do, the rules are still the same. They haven't changed. And it is available in 29 languages. So I'll put the link on that page. Helen, have you got the link that I've put in, or is it? It's all right, you're muted. It's okay. We'll put and we'll make sure updated version. Reminder about how to
at the end of the session, sorry to interrupt, Shelley, at the end of the session we'll ensure all the links are in the PowerPoint and we'll send the PowerPoint round. And of course the session is recorded to watch later. Thanks, Shelley. I'll move you on.
Thanks, Helen. Yep. So the third key message that we're encouraging people to adhere to is that they get their flu vaccines, and some of you have probably been busy helping with administering flu vaccines in car parks and cars, in after-hours clinics, but that's really important. We know that the crossover between the COVID-19 and influenza makes it really, really even more important for vulnerable groups to get their flu vaccine. We know that when people get the flu, in our experience, it can trigger heart attacks. So the vaccine is vitally important. The fourth message, which is on slide 7, Helen, is to keep your distance and practice good hygiene, doing things like all of this messaging you would be acutely aware of, but we encourage people to go to their health department website, hand washing, cough etiquette, alcohol-based hand sanitizers, avoid touching eyes, nose and mouth, and physical distancing. I'm sure you have heard all of that messaging. And the final message is while people are in isolation or confined to their homes, it's really important to stay active, which is by no means easy. I'm even finding that myself working from home, and to eat healthy foods. I need a mask in my. We've got
Shelley, we've just lost your sound for a moment.
Okay, I was just saying staying active and eating healthy food. It might have been because I put my hand across my mouth, like I'm playing charades. Sorry. So there is a sign-up page as part of this campaign on our website, so people can get information on healthy and staying active. Since the campaign was launched last week, we've had 75,000 hits, I should say, on the campaign page. So people are looking for information. On the 9th slide, Helen, we have just got the details around our helpline, and we have extended the hours of our helpline to weekends and business hours business hours, but including some weekends, and we may do that for a couple of more weeks, depending on the traffic that we get. But the helpline is there and available. Who are at high risk. Good chronic disease that everyone understands, something that people associate heart disease with. So we've had lots of queries from people saying, I've got heart disease, or I've got an arrhythmia, or I've got high blood pressure. Does that put me at risk? So there's been some information needs around just clarifying what a chronic disease or a chronic condition is. It's language we are all familiar with, but the general public perhaps not. I'm on to slide 10, Helen. I just wanted to talk about the My Heart, My Life project, which is a program that is delivered by the Heart Foundation. It's currently, before all this happened with the pandemic, we were in a pilot phase, and we're actually testing some new resources in 9 of our or 10 of our hospital sites in the metro. Actually,
Sorry, Shelley, we've just lost you a tiny bit again. I might take over for a moment. So the pilot program of the My Heart, My Life has been rolled out to 9 metro sites and 1 in the southwest. It's for people with heart attacks and angina, so your ACS patients. And as Shelley has said, due to the COVID-19, this is there to support cardiac rehab services who may not be able to provide what they previously have at this time. And yeah, Shelley, you back?
Yeah, can you hear me? Is that better, Helen?
Perfect. Yeah, great.
Okay. I think what I was doing, I've turned the camera off so you can't see up my nose, and I've got the phone closer to my chin. I was turning my head to look, so that might.
Shelley, you're still breaking up a little. I might finish this particular slide. So we encourage patient self-management and to enrol themselves. They can enrol at any time through the website. They can text the word support or the number there from their phone, or they can call the helpline, which Shelley mentioned earlier. So the My Heart, My Life program is not a replacement for cardiac rehab. It's around supporting cardiac rehab. Yeah? Shelley?
Yeah, Helen, if it's better sound, I'm happy for you to continue on from here.
No, you're good there. You go.
Okay, then I'll hand over to you. So slide 11 just shows the resources that are part of this new pilot, and as you mentioned, Helen, we are extending these out to beyond the pilot sites by way of adding extra support to existing services. So you can enrol, you don't have to be part of the pilot, your patients can self-enrol to this project and they will get a telephone follow-up and a text message and an email journey over a course of a number of weeks, just to provide some additional support. And on slide 12, Helen, the other thing that you might like to, the other thing that people might like to use is a series of videos that are available on YouTube. You can just go straight to YouTube and Google Heart Foundation or YouTube link at the bottom. But there are the 6 steps which go through pretty much everything people need to know in recovering from a heart attack. So a useful tool in any circumstance. The other group of people that you might like to refer to the Heart Foundation website is the group of people who are high risk but perhaps haven't had a heart attack. So the My Heart, My Life booklet is for patients who've had heart attack or an angina. But then there are this category of group of people who are high risk. They might have high blood pressure, they might have high cholesterol, but they haven't got existing or diagnosed coronary artery disease. So this is a resource that might be useful to you. It's called Protect Your Heart, and you can download it from the website. The other thing that we also have on our website is a series of heart failure videos. It's an animation which outlines what heart failure is and how to manage it. It's very simple. It's been deliberately pitched to meet the needs of people with low literacy. So that's another useful resource to you. And as you know, with COVID-19, they're seeing rather terrible myocarditis and cardiomyopathy in the setting of COVID-19. So heart failure management and vigilance is really, really important. Thank you, Helen. I'll hand over to you, slide 15.
Yep. I've just, did anyone want to unmute and ask any questions at this point? Just go off mute and you'll come forward on my screen. If not, I'll keep going. You can all hear me? Yeah. So group education and group exercise classes, they have ceased, but most of the services continue to take referrals down in the metro area. So on the website, the Heart Foundation website is where usually you would go to find the service. So you still do that, however, you might find that there's a message saying at this time our classes are not currently available, and then certainly give the helpline a call. There's been, what we've seen lots of helpful strategies at this time. So we've seen changes to legislation, and the funding of the telehealth item number is fabulous. And I'm sure in rural and remote you are benefiting from that. Telehealth for primary care, again, a great initiative. Australia Post delivering medicines. On the 16th of March, the government introduced the home medicine service, and this was to protect the vulnerable people. People living with heart disease, people over 70, Aboriginal people over 50, people with chronic conditions, people who are immunosuppressed, pregnant women, and people recently who've had babies can benefit from the community pharmacies having established home delivery services. Also from the fact that pharmacists can now keep scripts on file and then fast track that electronic prescribing. And pharmacists allowed to repeat medications so that people who have come to the end of their month's supply can feel reassured they're not going to have any gaps there. What we've seen in the cardiac rehab world is, of course, as our cardiac rehab community are all great at supporting each other, we have seen that, and that's really refreshing for us to see. The Joondalup service, who you're all aware, had the big influx from the cruise ship, so therefore their cardiac rehab service ceased for the moment, and Gabby there is working in the telemetry unit. But the Sir Charles Gardner team have stepped up, and the community physiotherapy have stepped up and said they will be happy to receive any referrals at the Joondalup postcodes. What we've also seen is we've seen people really step up and make changes and be innovative. And Royal Perth and Fiona Stanley, they videoed their education sessions, their exercise sessions. At Hollywood, Tracy's sending weekly emails on risk topic factors. There's been increase in phone follow-up, increased telehealth and Zoom consults. Sir Charles Gardner are still there, have one-on-one telehealth and phone consults prior to home programs being individually designed. They will still see people one-on-one for an initial assessment and then set up that individualized home exercise program and safety guidelines for exercising at home. Patients, again, it's individualized and very patient-centric, followed up weekly or at 4 to 6 week intervals. They have direct access to a physiotherapist via their email and business phone Monday to Friday. We've seen the use, oh sorry, someone got a question? Oh, okay, I'll keep going. We've seen the use of smartphone and tablet programs. Nikki Gordon uses something called PhysiTrack, where patients get a digital copy of their own exercise program. They have videos, written descriptions, and there's chat capabilities. So that's that support of like people who have cardiac problems. It's all encrypted and safe. 3 different types of classes over the life sessions, beginner, intermediate, stretching, including mindfulness, and the ability to monitor everyone to ensure their technique is correct and safe. Another initiative is writing to the doctor outcomes of those conversations with patients. So again, that comes from a more consumer-driven focus. We've seen in the Southwest that CardiHub, that has been fast-tracked to become available. And those of you who don't know about CardiHub, it's a web-based program, and yeah, that's commenced down in the Southwest. We have people looking at developing new programs, strong heart programs, to allow people to regain their confidence and boost their physical and mental fitness, and link with health professionals and patients in similar situations. So we look forward to hearing more about that. We can access, so in the kindness spectrum, we can access heart health resources from Victoria. So your patients are welcome to link into the cardiac wellbeing programs offered by the Australian Centre for Heart Health. They have a Back on Track program, which is 5 sessions about helping people to stay physically active, eat well, stop smoking, and set goals for their recovery. They have Teleheart, which is again around that facilitated self-management sessions. And they have cardiac counselling, because there are many, Sandy, Shelley and I, Sandy's linked in today, have been helping on the Heart Foundation helpline. And really, it's that vulnerability. We all feel it. We all feel slightly different. We all are vulnerable for our family members, ourselves, and it's great that you've got someone, a counsellor, a trained counsellor, is only a phone call away. Another, I'll go more into mental health in a minute, but globally, the European Association of Preventive Cardiology have said, in the near future, this disaster for sure will stimulate innovation in cardiac rehab, particularly for alternative, person-tailored, remotely guided, home-based programs. And that's exactly what the cardiac rehab community in WA have done. They've stepped up to that. And they've done that already in the face of COVID. There are links there to the recommendations from Europe. They are also the International Council of Cardiac Prevention and Rehab, ICCPR, are running a webinar around these changes and these recommendations. So this is New York time on the flyer you see there, but it will be on Friday the 24th of April, 8 till 9 WA time. And to get to it, you email globalcardiacrehab@gmail.com. We're all well aware that they have, the pandemic has hit Europe massively and has hit them prior to us, and so there will be many lessons to be learned there. Also in this step up to ensure that we have the right means for our patients to be able to exercise right at home, provides free workouts, and they're all accredited exercise professionals. You can click onto this link, and there are numerous videos around strength training, aerobic activities, falls prevention. And this one here is a 10-minute workout with Nikki, and she delivers cardiac rehab, usually on site at Murdoch University. So this is a 10-minute workout, and all based on the Heart Foundation recommendations. The Heart Foundation itself has exercise posters, and you're welcome to, when you receive the PowerPoint, print them off bigger. We can send them as attachments and laminate them and or pass them on to those who would like them and benefit from them. There are level 1, and then there's level 2. And you can be just, a warm-up. You can grade the way that you would put any of your clients through these exercises. Yeah. There's been many Aboriginal resources developed, which is really great to see. Did someone have a question or a comment? No? Okay. So the Department of Health have released a number of posters which are fantastic and really relevant and pictorial for those in the Aboriginal community. I'm not sure if any of you have seen this beautiful video by Tootsie Daniel from Roebourne, and it is just a beautiful way for children and the community to learn how to wash their hands properly. And she sings it to Bye-Bye Corona. And it's really very great. And there are also other videos of the Roebourne elders speaking to the community to ensure that the message of social distancing, of good hygiene is out in the communities, because these people are very, very vulnerable. And this is a really essential messages they're sending. On the Aboriginal front, there are some fabulous videos from St. Vincent's, the video series. You can again just click the links here, and there are numerous really great resources there for yourselves and your patients. On the St. Vincent's site, Shelley alluded earlier to health literacy and the level that we need to pitch our language at. And I must say this is a gold find, this resource. It uses language like feeling down, my mob, big body, bad tucker, and really relevant for the Aboriginal community. So I hope you will check out these resources. I did mention, I've named this slide wrongly, apologies. This slide is around acknowledging people's anxiety and vulnerability at this time. And the websites where the people you would go to in this instance are Beyond Blue. Life in Mind has some fabulous resources, and I hope you'll check that out. The Black Dog Institute and Are You OK is every day of the week, not just one day. And they have some COVID resources too. We spoke earlier about the psychological effects of COVID. This is a fabulous resource. The PORTS resource is the Practitioner Online Referral Treatment Service. This is manned by clinical psychologists. And it's a 1-800 number at the bottom of the flyer there, and you can get in touch with them, go to their website, and you can refer your patients to them for ongoing psychological help. I think I'm going to pass you back to Shelley at this point, unless there's any questions. We can wait till the end for questions if you like. I'll hand you back.
Okay,
Shelley,
Helen,
you
can you
good?
hear me? Yep. Helen, can you hear me?
Yes.
How's the signal? Just okay. I haven't done anything differently to my phone, and it was okay when we started, so I must apologise if it's difficult to hear. Is it all right at the moment, Helen? Yep, okay. Okay, so on slide 29, you'll see that we have
Shelley, I'll pop back on again.
It's not good?
You back? Yep, you want to start again? Cheers.
Okay. I don't know why it's dropped. Some kind of background. It was developed by Australia, New Zealand thoracic surgeon research council, and as a collaboration. I've put the link there. We're on slide 30, Helen. And basically this consensus statement has got some of the information that I've already gone over in the campaign for consumers, but it does summarise that people with heart disease and higher risk are at higher risk of COVID-19 complications. People with heart disease should continue taking their medicines as mentioned before, and all efforts should be made to minimise the risk of exposure by safely reallocating cardiac patients and prioritising those at high risk. Just some examples of that having been done already. Up Hospital, Helen mentioned, received quite a few patients from the crew. They have 2 cath lab teams, so if one of them should become affected, then they have another team that can go into the cath lab. So some of their decision making and around plasty as a result of, and some of the decision leading to thrombolizing as opposed to going for a primary angioplasty. So we are
Shelley, you're just a bit shaky again. So could you
I think it's signal health.
Yeah. So Shelley was just saying there are different decisions being made around, there are two different cath lab teams, and it may be more appropriate to thrombolyse than go straight to angioplasty. I'll hand you back to Shelley.
Get Scopia onto and Scopia.
Yeah. So telehealth, sorry Shelley, I feel like I'm taking over. So yes, telehealth, Scopia, Zoom. I think Stanley's taping this, Stanley who works in telehealth here, but I think he would also say that, you know, his team would be looking at other platforms as well to use. Yes, and yeah. So, but the big messages from the consensus statement: people with heart disease are at higher risk. Hearts and lungs don't work independently. So I think the general community would get that drift. Keep taking your regular medicines, because there may be some noise around ARBs, but it is not yet proven. And yeah, and just prioritising cardiac people as high risk. Yeah.
Helen, can you hear me now?
Yes.
Okay, just a point to make on the next slide, which is the Cardiac Society of Australia and New Zealand consensus statements and position statements. The links that we've put on that page have changed because the statements have been updated. They're updated on a weekly basis. So in the slides that we send to you, there is a which you'll see the updated statements and more statements. So other statements have been included. So just don't worry about the links that are on that page. We'll send you the new one.
Yep. Great. Yes, and as I said at the beginning, things are changing very quickly. And so there's new information, and hats off to everyone for, you know, pulling these things together so quickly. Shelley, I've moved you along. There are, of course, many evidence-based resources on the Heart Foundation website, and you can also have these on your phone. The heart failure guidelines are available for you to download onto your phone, and any information, the website is regularly updated, so please check it out. And the new COVID, sign up to the new COVID messages. Shelley, you back?
You take it from here, Helen.
Okay. Yep, there are a selection of videos that have been made from the European Society of Cardiology, ventilator therapy in COVID-19, surviving COVID, cardiovascular drugs, diagnostic imaging. The lady at the bottom, you can't see her, but it's how to run your coronary care unit when, yeah, etc., etc. So there may be many of these that are quite useful to you. So yes, if you are in a situation of the calm before the storm, please check these out. The other thing that you will no doubt be keen to become excellent at is the telehealth, the use of telehealth. And Norman Swan delivered a webinar a few weeks ago, which had some fabulous techniques and ideas for assessing patients, and the link there, you can watch this, it's available post the event. Also on the other side was from La Trobe and Curtin University, two GPs who have a webinar around the successes of telehealth. There's a partnership between RACGP, Rural Health West, Primary Health Alliance, which sends regular updates. And I saw today, I received these updates from WAFA, and there will be a series of videos coming through this. So that link also, you can sign up and then receive the updates on the new webinars coming. This is from the Resus Council in the UK, and it is really good, very quick 2-minute video around CPR in a COVID environment. Yeah. And lastly, we really need to know, we heard from Anne-Marie Dunant that things haven't changed dramatically, rurally and remote. Many people, their services are continuing. They did provide telehealth, they did provide phone follow-up, they did do all the things that have now been made available in Metro services. However, we just want to know what's missing, how can we help, and at this point I'll maybe go round, and my vision's not that good to see the site. The other thing I would like you to do is, if you can get out your smartphone and take a picture of the QR code, you will then go to our evaluation, and it always helps us if you're a shy person over the video conferencing. You can ask us questions through that evaluation form and let us know about other sessions you might like to see in this series that we bring you each month. Shelley, any closing comments before I put it out to the room?
Okay. No, Helen, sorry about noise quality. Sound quality.
Okay, look. We have to work in environments that aren't always perfect. So you will be sent an online evaluation, so I'm just going to pop this down, because then I think I can see you all bigger. If I put that out the way. No, that didn't help me. Maybe Stanley will make you bigger. Have we got any questions from Northam? Or all you have to do is take yourself off mute and ask a question, you'll come forward and I'll be able to take your question. Anywhere really. I just can't see where you're from.
We don't have any questions at Northam.
Nothing from Northam, okay, good. Can I just ask from Northam, do you provide telehealth? Have you had changes to the way you run your programs?
We're providing phone consults at the moment. We haven't been very successful with telehealth because most of our population don't own the technology, I guess, or don't know how to use it, so it's quite difficult. But phone consults have been all right so far.
Great, fantastic, good.
Can I
wish I could
ask from Fiona Stanley? So we just had a couple of, or just one question basically, about we've been documenting a little bit of a disclaimer for our exercise advice that we're giving, just because normally we would see the patient face to face and be able to assess, you know, their observations, heart rate, blood pressure, etc., while they're exercising, and give exercise advice based on telemetry monitoring and what we were seeing, which obviously we can't do at the moment. Are any other sites including a little bit of a documented disclaimer about, you know, the various, you know, potential limitations that they're facing with not being able to assess patients face to face, but still giving out exercise advice over the phone?
Yeah, I did see a chat around that in the ACRA Facebook page, that yes, people were, and also you know, not using 6-minute walk tests, what's the measure we should be using, etc., etc. So not being a physio, are there other physios in the room who can help with this question around assessing people, having a disclaimer when you're unable to
Hi, it's
blood
Grace up in
pressure?
Headland.
Yes?
Yeah, we often have, I think it's probably the difference between a remote area. We've often had cardiac rehab people that we've sent programs to and not ever been able to see face-to-face. So this is pre-COVID. So we've often just provided programs, try to like consider what musculoskeletal limitations are, and often just always prompted and checked in via phone if that's their preferred method, or via whoever else is their contact person. So we haven't been ever doing a disclaimer as such, but of course giving all those appropriate warnings that it shouldn't hurt, it should feel like you're using muscles and all the rest. So I don't know, we haven't been given any direction, and all of this presentation has been quite helpful just to give us a good refresher on what people now, what we can again send out to those that aren't coming on site. So that's my only comment. Thanks.
Thank you.
Fiona Stanley, can I ask, did that address the measurement of like vital signs, etc.? Can you let me know how you felt?
Well, I guess it's good to know that other sites are giving out, you know, their individualised exercise programs without having assessed the patient completing them face to face. But then I think we're still having discussions around particularly some more of the complex or high-risk patients that we would usually monitor with telemetry. But yeah, I was just interested to know people's standing in that, because we haven't really been given much guidance from, you know, our head of department at this stage. So yeah, just interested to see what the feel of the general kind of group was.
Sorry, hi Helen. It's I think it's just good to know what other people are doing. We just wanted to get a bit of an idea about if we're acknowledging at the moment, obviously what we're providing quite different to what we previously provided. It's probably the take-home thing we're trying to address with that little note on our notes, is that what we're providing in assessment and is different to what we could previously. So it's just helpful to know if others are experiencing similar and how they might be getting over that bit of a hurdle. We are at Furnace Stanley too, so you guys might see it filter through depending on how long this goes on from patients coming with us. But we are looking into trying to maybe do a couple more 6-minute walk tests as discharge assessments from our end.
Yep. Oh, good. That sounds good.
So they're obviously going to be submaximal, so it's not quite appropriate to do that when they're still inpatients, but we figured that's probably going to offer a bit more information and guidance to people when they're then doing follow-ups on the phone, unable to see them, versus, say, the stairs test for cardiothoracic. So at the moment we're looking a bit in cardiothoracic doing that, probably doing the stairs test as well when we can, but maybe adding the 6-minute walk test in when we can too. So you might see that filter in your respective centres with some of your patients coming home.
Yeah, that sounds great, Tim. And it gives some measure, not as accurate as you would want, but it allows those in rural and remote to have something to go by. The other thing that's come into my head when talking about measuring, is that enablement, that self-management approach. The more people that we have confident to take their own blood pressure, their own pulse, the more we can encourage self-management, which has always been our stance. It's really a good time to instill that in our patients,
Sorry, one other thing, Helen, I did want to say from Fiona Stanley, one of the most valuable points for me with this talk too was hearing you say, Helen, if it's correct around all the sites, is that most people are continuing their service for cardiac rehab in some way, shape or form. I think that's probably, I think there's so many people providing this service in so many different places at so many different levels. It's a challenge to know what the tertiary side of the ones maybe seeing these guys initially in hospital need to provide ongoing, not knowing what's close to home for them. Is the cardiac directory, in updating that, is that still the, EpiCenter cornerstone place to provide the latest information for different centres to tell us what they're doing?
I believe that in the eastern states, that's obviously there's way more centres and that's harder probably for them to manage, but from a WA point of view, the only service we have heard to is not accepting referrals. It is the Joondalup service, and we can ensure that the cardiac rehab directory would say Shelley, I'm sure can confirm this, that could be updated in the short term to say currently unavailable due to COVID-19. Otherwise, as far as I am aware, and I'm really happy for anyone to contact me to update what is written about their service in the cardiac rehab directory. If anyone would like a short-term flag on their service saying currently this is what we provide, Shelley, I'm sure we can make that happen. Yeah?
Yeah, that would be really, I think that would be helpful, certainly, just so everyone knows what everyone's providing. If it's easy to change, then that's great. It shouldn't
be a hard ask. Shelley? Did you
Helen,
want to speak to that?
Yeah.
Sure. Good.
We can try that. Yeah, so if people let us know, we can... the thing about the directory, Helen, is that people have their own login and they can access their own details. So ideally they should be able to...
Absolutely. Yes, Tim, you can change it yourself. Yeah.
Thanks, Helen. Yeah.
We understand you guys are all under duress, so, you know, if you can't change it yourself, flick us an email, okay?
Yeah. No, that's all right, we should be able to. At the moment, we're referring to maybe our nursing service a bit more regularly than we had in the past, just to help give another layer of support to other centres which might have some altered staffing. So if anyone's finding that's happening and patients are getting confused with multiple referrals, then please don't hesitate to get in contact with us around that you guys are managing fine with the patient in question.
Yep.
Thank you.
Always better to have two than none. Can I take any questions, Sandy? Any comments, questions?
I'm okay. I was just thinking that Nikki Gordon might be able to provide some intel on what she's providing patients, or how she's assessing patients, if she's doing telehealth successfully, and people she hadn't met before COVID.
Yep. So Nikki was dialing in, but Nikki, you're right there. Yay! Thanks, Nikki.
Still doing Nikki.
That's okay. So we are really limited in the assessments that we do. So we do still run a 30-second sit to stand and a couple of balance tests if appropriate. It is really hard with assessing fitness and physical activity, so we just use the International Physical Activity Questionnaire to get a good idea about what they're doing at the moment. We can't really assess.
Oh, Nikki, your sound's gone a bit. Oh. I'll give it a minute, but I think it's gone. If anyone would like to, Nikki, you're back on. No.
It's hard to get the exercise responses. We are being quite conservative in our prescription with new patients anyway, and because we use PhysiTrack, which does have that chat function, they can let us know really fast if they're getting any pain or any abnormal symptoms, and we can adjust their program.
Had others in the room known of PhysiTrack? Physios in the room? Were you aware of PhysiTrack program? We are.
We're just sorting out our licenses for that at Fiona Stanley.
Yep. Okay, sounds like a good thing to look into. I'm aware we've gone over time. Were there any pressing comments or questions from the room? Shelley, any last minute thoughts? I think Shelley's dropped out again.
I'm here.
Are you? No, all good. Thank you all so much for attending. Please let us know what you would like us to bring to you. The next session was to be around chest pain management, but that was going to be Gabby, who is now working in the telemetry unit at Joondalup. So possibly medications, because we might have actually seen some evidence around things. Please let me know what you would like next month, and we will try our best to bring that to you. Otherwise, please stay safe and well and practice everything we're asking our cardiac patients to do. Take care.
Cardiac
Thank you very much. Thanks, Shelley.